Hey there, this is Dr. Bob McIntosh with Health Source Chiropractic, and I'm taking and sharing with you lacrosse ball talk. And so what's happening with this lacrosse ball talk is I'm teaching you ways to be able to create new movement hygiene within your body, whether it's neck or shoulder, pecs, back of shoulder, your spine, your mid back, your low back, any of those areas, your hips even. I'm helping people sleep better. I'm helping people eat better. I don't know about that. Well, maybe if you're spending more energy. So what we're doing is we're changing the neurology of your body and how it works, but we're also changing the anatomy and how much stretch or how pliable the tissues are. So when we're talking about these tissues, what happens is through repetition, whether it's a runner or a CrossFitter or a person doing yoga or a person that sits at a desk or a person that walks or your brother or sister or mother or father that are doing something in repetitive order and they start talking about knee pain, this one's for you. So knee pain is going to be something that can be on the outside, the inside, or the front or the back. And so I'm going to talk about outside knee pain specifically, and so I'll be able to share this with you so you can share it with others and help them be able to feel better as well. So outside knee pain, you don't need to go to the orthopedist right now. If you're having instability in the knee, things like that, make sure you get it checked, and I can go through and show you orthopedic tests and see what's going on in the knee. So if this is the knee right here, this is the outside of the right one for me, and the inside here. So this area right here is what we're talking about. It creates a hinge, okay? And there's literally a side piece that's flat like this that attaches to it, and it allows the knee to straighten and allows it to bend. And so with that, it rubs back and forth, and then when you squat down, it can pinch it and create a lot of pain, discomfort, those types of things. So you can use the lacrosse ball with your palm of your hand starting off, and what'll happen is you'll go down the thigh here, down until you feel the bony knee, and then you drop down and you feel kind of a valley right there. That means you're in the knee joint itself. And so sit there and go back and forth into the knee joint and go up on the top, down on the bottom. So I'm going to pull up my pant leg to show you what I mean. So you can see this shadow right here. This is the knee joint that we're talking about. The ball falls into that valley. And so that hinge, that tissue that's sitting just like my fingers are right there, it can go this way, it can go this way. But what happens is we can actually dig into that and break up that inflammation or tendonitis in those areas and make this tissue feel better. So spend some time on it, and you can roll with your hand like this on the outside, roll through the joint line, roll up through the thigh, roll up the thigh. There's two things that come through here. There's the iliotibial band, which comes up from the hip all the way down and plugs into this part of the knee right here. And so what happens is it can be rubbing on that tissue and creating inflammation or tendonitis, or it can be the actual ligament of the knee that holds it together. And so that is what you're wanting to sit there and rub on, and you'll find that super tender spot, and you'll just rub that spot, and then eventually it'll start to move better, feel better, less inflammation. The next step is you can actually lay on the ground. So put this thing on the ground and roll back and forth through there, and then you can put extra pressure through that as well to roll through the knee joint, go back up through the knee joint, up on the femur, up through the IT band here, and then down the actual lateral tibia or fibula out here. So hope that helps. Hope you have good information for knee problems. Just dig into it. Really spend some time focusing on that. Create repetition. Change the way that the fibers are attaching to the bone. Change the way that the fibers are actually sliding past each other, because they're wanting to stick together. If we can break them up with repetition, they actually start to flow better and stop creating that inflammation that's sitting in there causing your pain. So I'm Dr. Bob McIntosh. I hope you enjoyed the knee this week using the lacrosse ball. Good information. Please share the information. If you have more questions on knee problems, please feel free to come in and we'll be able to help you out. So have a great week.